Welcome to another episode of Better Health Through Movement and Wholeness. Hi, my name is Dr. Tom Naro, and my guest here is Dr. Vasanth Kainkaryam. How are you today?
Good. How about you?
I'm great. Thank you. I appreciate you coming on the show. So before we start off with some questions, the first one's going to be about stress. I just want to introduce you a little bit further to our listeners, our viewers today. So Dr. Kainkaryam is a primary care physician, and he has amazing bedside manner. We've met before, and it's palpable. He focuses his care directly on his clients. Now, he's the owner and operator of 4 Elements Direct Primary Care, and he has 2 locations, South Windsor, Connecticut, and then Rocky Hill, Connecticut. He works with pediatric, adult, and geriatric patients. And unlike other primary care physicians, Dr. Kainkaryam uses a subscription model to deliver personalized care in a way that you don't find when using health insurance. So coming back to our first question here, Vasanth, you told me before that you see a lot of people in your offices for stress. So with all the forms of stress that we're seeing these days, what do you recommend to your clients when they present with signs of stress and anxiety?
It's a good question. I think this year in particular has triggered a lot of stress for a lot of people, right? I mean, you've got work-related stress, you've got kids at home, school is closing, you don't really know what to anticipate, and then you've got sort of, do I take the vaccine, do I not take the vaccine? So we've been inundated with a whole different, almost like we're living in a different world, right? And that itself causes big adjustment issues. I think one of the things that we're probably not doing as well is actually just talking about it and calling it out, right? So I think number one, you've got to talk about it, right? And I think, for me, my job as a physician is not just listening to what you're telling me, but really paying attention to what you're not telling me. Like, what does your body language tell me? What is your demeanor telling me? What are you hinting at that you're not overtly saying that, frankly speaking, I just call people out on and say, hey, you know what? Like, I'm sensing this. And oftentimes I find that taking that leap of faith and trusting your gut allows them to open up and tell me things that they may not necessarily have come out with on their own, right? And I think, and part of that is creating an environment that's welcoming and inviting for it. So I think the first thing, number one, is talking about it. Number two is figuring out, all right, so what do you do now, right? So we all have stress. Stress is normal. But when stress, impedes your functioning or your activities of living, then it's a problem. So then the question is, what do you do, right? Oftentimes, what I hear from a lot of people is they just want someone to listen. They need to vent. They need to feel validated, let it out of their system to say, hey, you know what? Yeah, sometimes life sucks. It happens, right? And so, but oftentimes in the medical field, we're taught to be very sort of sterile in our approach and not be real. And that's sort of something that I've truly valued, is just be authentic. Tell people, you know what? Yeah, I go through it too. Validate what you're feeling. And then you build from there. Oftentimes, I also do acupuncture for stress and anxiety, and a lot of my patients get great benefit. I've had patients tell me they haven't slept as good in 10 years. I've had patients tell me they feel like they're high on weed when they're... So, it's been amazing to see what such little interventions, how far they can go. So we have a lot of options out there. We just have to make ourselves aware of what they are.
Okay, great. Well, thank you so much. And I didn't realize, I guess it really is the big elephant in the room, stress, right?
Yeah, it is. And like I said, we have to ask about it. We have to talk about it. And we've got to make a safe place so that people can actually let it out. I mean, it often happens to me, and I don't know why, where I meet patients the first time and they're pretty much in tears in their visit. Not my fault, but giving them that space to say, I'm here to listen. I'm here for you.
That's great. That's great. Okay, question number 2. So your patients, when you work with your patients, you don't work through insurance. It's more like a monthly subscription to Netflix. So what problems do you solve for your clients that insurance-based primary care providers can't?
Yeah, that's a good one. And that I could go on about, but I'll try to keep it brief, right? So number one, health insurance is not healthcare. People often think they're the same. They are not. Insurance is purely a way of paying for care, right? So you can have good insurance and not reach your doctor for 3 weeks. What use was that, right? Or you can have zero insurance, like some of my patients, and get a hold of me the same day. So I think number one, you got to separate the two. Insurance is just a payment vehicle. Care is care. Doctors provide care. So that's number one. So number one is my patients have direct access to me. Number two, cost, right? So people don't know that insurance really increases your cost when you use it for low cost services. So things like a strep swab or an office visit. Honestly, it's pretty stupid to go to the doctor to say, oh, you know what, like you have a cold and walk out with a bill of $200. It doesn't make any sense, right? So, but we all do it. Why? Because we're taught to think that is the way things are done. But my patients don't pay any copays, right? So their subscription includes their in-person visits, their phone calls, their emails, or texting. Oftentimes they get to text me a simple question that in the traditional model would have required booking an appointment to who knows when you're going to get it, seeing a doctor or provider that is probably not your own PCP, and then walking out with a bill that's probably far exceeding what really the cost of that quality of that visit really should be, and what, for like 8 to 10 minutes, right? So my patients get access. I help them save costs on their care with or without insurance, right? So a lot of my patients, even if they have insurance, choose not to use it. I get them in much faster, right? Same day or next day. They have continuity. They always have their doctor. They don't see anyone else. They get their doctor. And lastly, it's time and quality, right? I mean, so when we're talking about stress and validating emotions, you can't do that in an 8 to 12 minute visit. I spend an hour and a half, sometimes 2 hours with my patients. You get to know them as people. And then you begin to see what their lives are like and pick out things that you think are relevant, right? So, and statistically, only 11% of our health is determined by the medical care we get, right? So huge chunks of our health are determined by our behavior, our social circumstances. And as a doctor, if I can't explore all of that with you, there's no way I'm going to help you get healthier.
Wow, amazing explanation. That makes total sense. So, third question, the pandemic has really changed businesses. Like, a lot of people are working from home. Some businesses have literally gone out of business. They've had layoffs, policy changes. So it really comes down to affecting employees, and we're here to talk about their health. So what can you tell us? What do you think employers can do to help protect their workers' health right now?
Yeah, I think number one is, do they even have a person they're getting medical advice from, right? So that's number one, right? So, I mean, sure, it's good to go on the CDC website, public health website, but you need someone who understands the culture of your company, right? And so one of the things that I do is not only do I work with individuals, but I have employers who sign agreements with me where I help, where they give direct primary care as a benefit to their employees. And oftentimes that results in a communication avenue where, hey, you know what, if the employer is stuck with a question like, employee came with this, what do we do? They often reach out to me as sort of their company doctor to help give not the employer advice on policy and decision-making, separate from taking care of their employee as an individual. So that has been really fascinating. I think employee wellness is a huge aspect. But I think as an employer, the biggest thing I would ask you is, what benefit are you giving your employee, right? Every day your employee is out of work, whether they're sick or whatever, productivity gets hit. Your customers might get dissatisfied because they don't have access to you or their services you provide. So you have to pause and think back and say, how am I keeping my employees healthy, number one? And number two, just as my own bias with DPC, right? Because one of the reasons I do this is I want to help small businesses, because by providing these DPC memberships, they're not just guaranteeing a payment vehicle for their employees, they're guaranteeing that their employee has a doctor. They're guaranteeing that their employee can same day reach their doctor to say, hey, you know what, I threw out my back, what do I do? Rather than waiting for 2 weeks and hurting. So I would say for employers, step back and say, what kind of benefits are you providing your employees in the first place? Learn about what's out there. There's a lot of technology platforms and things, and take the risk to explore those, because your employees will love you in return.
Yeah, great advice. Well, thank you so much for sharing your knowledge and experience today, Dr. Kainkaryam. Would you like to take the final moment to share with our listeners a little bit more about your business?
Yeah, I've worked in corporate healthcare. I was corporate healthcare. I was a chief medical officer of a large health system. So I pretty much worked in every avenue of healthcare you can. And to me, direct primary care is stupidly simple. It is the way healthcare used to be, but with a modern twist. And for me, it's about the relationship. So for folks who really want to get to know their doctor and vice versa, who want personalized care, who realize investing in primary care will save you costs long-term because I will help you work with the system. It's enjoyable. And as a doctor, the burnout rate among physicians is 40 to 50%, right? So I challenge my patients, ask your doctors, like, is your doctor even happy doing what they're doing? Probably not, right? And so I love what I do. I work for my patients. I help support my patients. So I think, it takes a while for people to understand, but once you get it, honestly, as a doc and a patient, there's really no turning back.
Excellent. Thank you. Great. Well, at the end of this interview, there's going to be a slide that shows your contact information, so people will be able to get a hold of you via email, phone number, or your website. So
awesome.
Yeah, this was great today. Thanks so much. Look forward to maybe doing something together in the future.
Awesome. Great. Thanks, Tom.
Okay.